So, welcome back to another lecture of this psychiatry and overview. In the next three lectures, we will try to cover some special topics after this overview of adult psychiatry and child psychiatry, which we did in the last lectures. One of them is a very common term which we use. See, a lot of terminology in psychiatry is a common language like depression and schizophrenic, which people use loosely, but in clinical setting it may mean differently. So, today we are going to talk and take an overview of what we commonly know as a group of disorders called personality disorders. You all would have heard people mentioning to each other that he is personality disorders or he is paranoid. Paranoid is one of the most common things which is being used to comment on people who are suspicious. But what exactly are these personality disorders and how do we decide whether they are a group of problem of common living or a part of the range of normal behavior or they are disorders. So, if you look closely, but at the concept of personality. So, what is personality? Some of you may believe that, and a lot of people used to believe that a child is born like a blank slate and the nurture can write down the whole story on the child's temperament. We talked about the genetics and epigenetics, if you remember, in the initial lectures in neurophysiology. So, personality, one is born with a temperament. Normally, when you talk of temperament, you talk about attention span, the activity level, the emotional reactivity, the way the child reacts to others, the mood state, and so on and so forth. But based on this temperament, which is almost like a blueprint one is born with, which is probably a core, the personality actually starts forming in late teens and early adulthood, and that is your behavioral pattern which persists throughout life. So, each one of us with variations, even we may have a common genetic pool, but still there are variations in genes. The variation is in the expression of the genes which changes your behavior. So, people have definite patterns of behavior which more or less persist throughout the life, and that is your personality. So, you have to look, if you look at anybody, you have to look at his traits. Traits are more or less permanent behavioral patterns, and states are transitory behavior patterns where person may behave differently depending on the external circumstances. So, if it is a situation to be sad, you are sad, that is a state. But if you are sad all across all situations, that becomes a trait. As I said, it is the interplay between the genes which bring your temperament and your the whole blueprint of your life, and that is modified by epigenetics, the good old debate of nature and nurture. But largely if you look at it, the personality is formed of, or let me put it a different way, the blocks of human mind, the functioning of human mind, which constitute personality are cognition, emotion, reactivity, impulsivity, so on and so forth. If you put all these things together, the dynamics of all these various aspects and the subsequent behavior, which are more or less predictable patterns, constitute the personality. So, when does all of us have different type of personality issues? If you just do a random survey around yourself, look at 100 people, you will find all variety, no two people will be alike, but still you will largely be concerned whether that person is behaving normally. Most of us behave normally in given situation, more of in the sense that we have our own patterns, but more or less they are adjusted to the world around us. So, when do we start thinking that it is a disorder? It is a disorder when your pattern of behavior, your cognition, your emotion and the subsequent output starts causing suffering either to self, leading to a lot of maladjustment, or your behavior causes problems to other, not on one occasion, not as a passing incident, not as a transitory phase of your mind state. Like you suppose you suffer a failure in life and you get very angry, but if it happens once, it is all right. It is a possible state induced emotional disbalance, but if it continues in some way that every time you fail, you have the same behavior set, that causes problem. That could be an indicator to your the coping pattern. It leads to persistent maladjustment. It is a relatively persistent behavioral patterns, as I said, starting early adulthood and late teens, and periods of adequate functioning which may intervene dependent on external factors. What is important here is two things. One, that suppose you are behaving in a certain way till a certain age of, for example, till 25 or 30, and then your behavioral pattern changes and then it continues. So, there is a possibility it may not be a personality disorder, because personality disorders do not start as a illness. As you remember, we are talking about bipolar illness or schizophrenia and some other illnesses. Those illnesses have a starting point, whereas if you look at this sentence, the behavioral patterns in fact have been there all through. And if you go back and take the history and check about certain behavior of the person, it can go up to late teens and early adulthood, and maybe the informant or the patient herself will tell you that this type of behavior has always been there. There has been no change in the behavior. Now, alternate diagnosis is difficult because diagnosing a personality disorder takes it can take quite some time, because let me show you by an example. There may be periods of adequate functioning depending on how the external circumstances are going. Now, take a situation where somebody comes and tells you that this person gets into the episodes of extreme sadness or extreme excitability or anger outburst. Now, what do you check? You check since how long it has been going on. One, how long does it persist? Because people get excitement, anger, irritability, if you remember, in bipolar illness also. So, what will differentiate? What will differentiate is the duration, the type of episode. Now, people with mania or hypomania can have a single day episode, and so can a personality disorder person. Very one of the personality disorder where we talk about impulsivity and bipolar illness, people can have the borderline personality, people can have it. So, what you have to look at, and some of these illnesses can really be traced back to late teens. But what we have to look actually whether the episodes are spontaneous, whether they are triggered by some stimulus, plus the episodes in personality disorder will be shorter, maybe linked to some external incident, some incidents or a reaction to some external stimuli, stressful situation, whereas the bipolar manic episode may be spontaneously triggered. But again, having said this, the diagnosis still remains difficult, and we have to generally establish what we call this. These are like diagnostic criteria. There has to be an enduring pattern of inner experience and behavior, which as a whole deviates markedly from the culturally expected. So, as I said, if you look at people around you, you will find whole range of behavior, but you consider it normal because why? What do you call normal? You call it normal because we would also have experienced same thing at some point of time. So, if you talk somebody is sad on failure, we know that it is normal. Or you get angry at somebody bumps a car into you, you get angry, that is a normal behavior. But if the person deviates in the sense that there has been a long pattern which the person reports, it can be in cognition, in mood, control over impulses, the way you look at your needs. There is an observed deviation in the manner the person relates to others. So, this you call as interpersonal. So, there could be a problem in, and mind you, these are patterns of behavior which have been continuing and they do not have a onset per se. Nobody will tell you that this person was different and now he has become like this. So, if he was different and now he has become suspect illnesses, but people will tell me he has been always been like this, suspect personality disorder. Behavior is inflexible. So, most of us, there is another sign of normalcy is that the behavior is flexible. Even in situations where you are finding it maladjustment is there, you will still try to adapt to it. But the personality disordered person continues to have maladaptation across wide variety of situations. So, if you are trying to assess somebody who has personality disorder, one cannot restrict to one simple thing. That okay, if somebody has behaved abnormally in one situation, assess across broad range, because when you look at broad range, only then you will see whether the person is having the same pattern of behavior in most situation. Whereas, somebody who does not have a personality disorder will adapt to the situation. These people are more inflexible, they have the same pattern, maladaptive patterns. So, that is one sign of having a disorder or not, because if you, when we will talk about personality disorders, you may suddenly feel that, oh, I also have it. Now, that is partly because a little bit of that trait, because we have a common genetic pool, little bit of trait exists in all of us, which has not expressed to a level of disorder. So, the other criteria is there is a personal distress, there is adverse impact on social environment. Now, this deviation is stable. This is important. The people may be going normally, like this is a range of normalcy, if suppose you take it as a line, and there may be a deviation and then come back to normalcy. This is an episode of illness. It can happen in mania or depression. In a personality disorder, this deviation starting early is more or less stable. It is not progressive. It is not that it will go worsening, or it is not that it will improve and come. There may be episodes like this, there may be improvement, but more or less it is continuous and it starts in while the person is developing. That means prior to 18 years, somewhere around 16, 18. And again, the diagnostic signs of schizophrenia, bipolar or obsessive compulsive disorder should be ruled out. The organic causes, like one of the common thing, if you remember I told you that when people have a frontal lobe tumor, their personality may get Fenner's gauge, if you remember, he had this rod across his left temporal and his personality changed, but that was an organic thing. So, we know there are personality changes after frontal lobe injury or tumor. We know that after temporal lobe memory is lost, but in frontal lobe there is something called Pick's dementia, where it starts with personality changes. So, we should rule out that there is no organic cause to it, but then it may not be a personality disorder, it will be called organic personality change. So, broadly if you look into the type of personality disorders, so they have been divided into clusters, cluster A, cluster B, cluster C. Sometimes we are not able to really pinpoint what type of it is, but you know the broad features of clusters. So, you can always say cluster A traits. Maybe the person does not have personality disorder, but some traits. And there's some highlighting points of each of these clusters. Like cluster A, the hallmark is there is an odd behavior, the person can be aloof, eccentric, and add suspiciousness to it. Now, a person who is schizoid has been, if you ask the history, the typical thing is that it will be odd behavior, aloof, never trying to make friends, doesn't want to make friends. Schizotypal people have lot of odd thinkings, either obsessive symptoms, magical thinking, and they are very eccentric behavior. Paranoid personality disorders are people who do not have schizophrenia. They are well rooted in the world, but they always, and we all know such people around us, who will never trust anybody, general mistrust with, even if you are doing good for them, they will feel. So, then there is a cluster B, which is marked by the emotional expressivity, the way they express themselves. So, they are very, very dramatic, impulsive, very erratic behavior. You are never sure with these people that how they are going to react in the next moment, and to what thing they will react, and to what they will not react. And the third is cluster C. These are people who are very, very anxious. We will talk about in detail about all this. So, broadly, so we all have these traits. Maybe we do not have cluster A, but all of us some amount of being dramatic, some amount of impulsivity, some amount of anxious, but largely our nature and nurture combination has made us having behavioral patterns which are more or less in a normal range, and they do not cause distress to self or others on a persistent basis. So, the common estimations are like paranoid is 0.5 to 2.5, schizotypal 3%, antisocial 3%, borderline. Now, do personality disorders formulate a different block of mindset? Yes, but lot of these personality disorder people, because of this whole disturbance in the behavioral patterns, they are often comorbid with other diagnoses. Their behavioral patterns and their response to help being offered often interferes with the response to treatment, and the incapacitation, they can also get predisposed, and these are very common things like substance use, what you commonly know as addictions, suicide, mood disorders, impulse discontrol, and anxiety disorders. These factors predispose them to having lot of, so it's like disorders and personality, they are both complicating each other. A lot of these have physical illnesses. They are some of the popular thing you would have heard that you call type A personality, but type A personality is not a personality disorder. Type A personality has some traits which always keeps them on a push, and they are always out to gain something, very anxious. So, they are predisposed to coronary artery disease, angina, psoriasis, Crohn's disease, and so called this whole range of psychosomatic medicine. So, what do we do when we suspect a personality disorder? As I said, it is difficult because one does not suspect personality disorder when they come up with the problems. But if you are told that, obviously you will ask since when it is happening, somebody tells it has been always been there, then you start suspecting. So, a complete psychiatry examination, rule out some other diseases, psychological examination, personality test, they are useful in telling you the predominant personality traits, but not very useful in making diagnosis in that sense. So, the two type of, as we know, you know ICD-10, which is a WHO based international classification of disease, and DSM-4, now we have DSM-5. So, as we mentioned, paranoid, schizoid, all right, and this is antisocial, emotionally unstable, histrionic, anancastic, anxious. So, you know the group, this is cluster A, this is cluster B, and this is cluster C. So, what are the hallmarks? As I said, if you look at paranoid, they are extreme sensitive to setbacks and rebuffs. These are the people who immediately will actually, if you look at it, they will personalize everything. Anything which is happening around them, they will somehow, they will personalize and bring it to themselves. The tendency to be a grudges, suspiciousness, and inadequate sense of personal rights. So, it is not always suspiciousness, it is like sense of entitlement. This is a very common thing in the society. You may have encountered or not, sometimes it becomes really difficult, especially in this male and female gender politics, where females are not financially independent, or they are, I should not say this word, but they are almost subservient to husbands. And husband wants to possess the whole social life of the wife. And they suspect that, okay, whom are you talking? And with this cyber revolution, with all this SMS and WhatsApp and everything available freely, there are a lot of people who suspect, okay, whom are you SMSing to, whom are you WhatsApping, or all that. And it becomes difficult for a clinician to decide whether this is a delusion or it is an overvalued idea. Self-referential, as I said, and for everything which goes wrong, they will have a conspiracy theory. If you observe carefully, and you will know such personalities, they are there all over. Schizoid is rarer than paranoid. These are the people who are just aloof in their own world, emotionally cold, their indifference to what people are saying, solitary activities, they are preoccupied with fantasy and low or no need of any confiding relationship. This is, now some of these schizoid people eventually turn to schizophrenia. So, this may be one of the precursors, some of the studies say so, and they are insensitive to social norms and conventions. Dissocial is also antisocial. I do not have to tell you who are these people. We all know a lot of criminals, high percentage in all prisons and all. They have, and they are one-off criminal is not antisocial, but you see the repeated pattern. They have unconcern for the feelings of others, attitudes of irresponsibility and disregard. You can get a list on the paper of, at a national level, people are hunting for these criminals and terrorists and some of these mafias. Incapacity to maintain enduring relationship. They really do not give a damn to what is happening. Their frustration tolerance is very low. Even a small thing which upsets them blows them off to violence. Now, some of them may initially have this sense of guilt, but as they grow on, as they move on in life, the guilt disappears and they have a rationalization for all the conflict behavior, always trying to prove themselves right. Now, some of the politicians may actually appear like this, but whether they are, we do not know. Now, this and the next group are the two things which we are going to see more commonly. Antisocial we have seen, we always have antisocial people, but there is something which was very well diagnosed in United States of America, Australia and England. We are seeing more and more, maybe because we are diagnosing more, or maybe because the social structure is changing, so that the biology which predisposes people to have this, which was not expressed in a more stable environment maybe few decades back. As the environment also gets destabilized and it becomes a high pressure life, these disorders which we commonly label as borderline personality are getting more and more expressed. So, a borderline person with predisposition to borderline personality or having a disorder in a stable environment with a supportive environment may not have been exhibited, but it is coming more on and on. As you see, the society is changing in the transition periods, the pressured life. So, there are two type of stuff in this. One is the impulsive type. These are the people with whom you can never be sure. They will suddenly act unexpectedly. You are cracking a joke and this person may suddenly feel bad and leave. And this creates conflicts with everybody. This is all connected. Or this may really lead to a behavioral explosion. Somebody may suddenly take a offense to what you are saying and not listen to the joke actually and start jumping around. They have difficulty in maintaining any course of action that offers no immediate reward. So, these impulsive people, you see a lot of small kids are very impulsive, they are doing something, they leave this and start jumping on the other. So, these are the people who want immediate reward. If it does not happen, they do not have the patience, and the mood is very, very unstable. You will not know any reason. Now, this mood changes will not be as prolonged or as intense. Sometimes it can be like bipolar, which has a definite onset and a definite remission. This is like going up and down. The person is all right, and then suddenly, sometimes it is all right, sometimes it will happen, sometimes it is all sort of variation. And the almost the flip side of it is borderline type. So, you have an impulsive type which is expressing without control. The mood control is gone in the impulsive type. Borderline, at least 3 of the symptoms in the criteria for impulsive. So, borderline will have to have at least 3 of this, and so borderline is a misnomer actually. At one point of time it was considered to be a borderline between neurosis and psychosis. A lot of these people behave almost like a psychotic person, almost. So, it is a misnomer. Now, we know it is more connected with what we call affective regulation. These people have problems with control of mood, the impulsive type. But borderline, the real borderline, which is emotionally unstable also, has uncertainty about self image. And you know such people who are not sure about what they are heading for, what do they want, this type of traits, all of us have it. All of us face similar things, but we all grow out. So, we may not land up in borderline personality, we have some traits, but we all grow out of it, and we know they get into unstable relationships. They do not have a persistent close relationships. So, every time it goes down, they will idealize some person and get into the lives very close, and after some time they will start not devaluating the person, not liking it. So, going too much into a relationship and then getting out. Every time this swing continues of going close and then going away, this creates an emotional crisis. So, every now and then they keep landing up in a relationship problem. I had a friend, I was very close and suddenly left. So, you can suspect that the other person has left him, but you go to the pattern, you will find this person has never had somebody very close. This extreme fear of rejection, that somebody is going to leave them. There is a threat of acts of self-harm, wrist cutting, popping pills, on every small thing what they do, what we call a deliberate self-harm. Most of these people can't, low frustration tolerance, every small thing will just blow them off, and they have a chronic feeling of emptiness. Even if they are trying to do something, they will not stop, they will not wait for something to happen. Even if they are doing, the sense of emptiness is always there. So, this impulsive and borderline, they are almost on a spectrum, one at the extreme of mood discontrol, the other a permanent sense of emptiness, problem with self image, this fear of that somebody will reject them, and in that process they either get too close to become very pally at times, and then the same person they will start hating. So, if you just run your mind around you, I am sure you will find, because this is something which is on an increase, whether because of better diagnosis or it is an increase in borderline, we are not sure. Histrionic, we know the people who self dramatize, every small thing they will create into a drama, and we know too bothered about how they are looking, being seductive, seeking excitement. Anarchistic is a precursor to obsessive. There are people who are very, very pedantic, who are always preoccupied with details, rules, organization, schedule, perfectionist. They will not sit quietly and always trying to organize things and create problems. Anxious avoidant is not so common, but there are people who are unable to decide about for themselves. They are always unsure of themselves, they always want somebody else to decide for them. Dependent is also just like that, that For everything, they need somebody else to decide for them because of the fear of being left to care. Mixed is where you cannot decide one thing, and the mixed type of traits. So, as I said, there are secondary complications, societal behavior, acts of self-harm, mostly in borderline, violence, risk behavior. So what do? The mainstay of treatment is psychotherapy. Pharmacotherapy, that means drugs we give only symptomatic. Now, psychotherapy depends on what type of personality you are doing, motivation, intellectual state, ego syntonicity. That means they are comfortable with themselves or they are not comfortable with themselves. So, the basic principle is you do a basic support to their emotional crisis, to situations when they land up with deliberate self-harm or damage, and then a specific cognitive behavior therapy. So, target could be permanent symptoms or actual state problems. So, I would end at this. It's a very long topic, but we are seeing more and more personality disorder, especially an increase in borderline, impulsive type and all. Probably it's related to the changing societal situations. We are seeing an increase in the expression of obsessive symptoms and anxiety. Overall anxiety has gone up, but personality disorder is a tricky situation still, because labeling somebody means a label for all for life. So, one should be careful, but if you just look around yourself, you will still find people who are either disordered or at least have traits. So, I will end at this, and then the next lecture, next two lectures, we will talk about something which is a special topic, which does not come into the mainstream psychiatry, but it is everywhere, and that is sleep. Thank you.